Good morning, everyone. My name is Jorge Ungo. My pronouns are he and him. I am proud to be a staff member of CCHI and am thrilled to be here with all of you for the second National Healthcare Interpreter Certification Summit. To get us started, we have an address from Dr. Ryden here from the University of Houston downtown.
Good morning and welcome everybody. This is a great honor for me to be here. My name is David Ryden. I'm the Associate Vice President for Curriculum here at UHD, and I'm very glad to see so many people here. I want to welcome, of course, the organizers, the presenters, and all of the audience. So thank you so much for coming. If you're from out of town, thank you for coming to Houston or Texas. Warm welcome to you all. As you see, this is UHD's 50th year as an institution. And of course, it's a special year for this organization here being 15 years. So it's nice that they both align. Thank you very much. I was going to say, but UHD has a much longer tradition going back to really the 1940s. It originally was a community college called South Texas Community College that was first started at the YMCA down the street and then moved to this large building you see here that was built in the 1920s. You probably came in from the train. And it's had this community orientation, you know, I guess we're getting close to 100 years and trying to improve the lives of our students, but also improve the community we live in. And this continues in the development of new programs all the time. So UHD has, at least for, I want to say since 2013 or 2012, has had a minor in Spanish interpretation and translation. And yay! With a focus, with a real focus on legal translation and interpretation, as well as, of course, medical Spanish translation and interpretation. And it's our orientation to, of course, we're right adjacent to the courts and the legal center here in UHD. And we're also adjacent, you know, by rail with a large medical center, which I assume many of you are basically inhabit that area during your working lives. So thank you for the strong connections you have with our students down in the medical center. And as I mentioned, we have this translation degree pending, maybe I didn't mention this, pending Board of Regents approval in May. We are launching a translation degree here at UHD. So, and this is to the hard work of the faculty. It's an interdisciplinary degree that involves Spanish faculty in particular. Dr. Ray Romero, who is one of the leaders in this organization, led this group of faculty, and this includes faculty from not only Spanish, but also technical communication and communication studies. So it addresses not just simply language skills, but also cultural and I suppose thinking about grammatical skills as well. So it's a pretty, you know, it's the only one in Houston that I'm aware of, and it's I think there's only 2 or 3 in the entire state. So this is a real, and I look at it as being the first step into sort of expanding programs and moving into the interpretation piece down the road. So I don't want to keep belabor. I realize that there are more speakers here, correct, Jorge? I want to, and I'm just here to welcome you all and just tell you a little bit about the university and our orientation towards the community and towards our students. Our goal is to improve the lives of our students and, of course, the lives of those who live in Houston. So, again, thank you all for coming and appreciate it.
All right, thank you so much, Dr. Ryden. Are y'all ready to get this party started? Yeah, that does not sound very enthusiastic. I have not even had a cup of coffee yet, and I've been watching y'all drink your coffee, so are we ready to get this party started? All right, so let's get some thank yous out of the way. Obviously, we want to thank the University of Houston downtown for hosting this incredible event. Dr. Ray Romero, thank you so much. I'm getting choked up, sir. Thank you so much. You have put up with so much from me over the last 5 months, so many thanks. We've got our Trailblazer sponsors, Academy of Interpretation and Masterword. Thank you for your generous support. We've got our visionary sponsors, AMN, Cross Cultural Communications, The Language Group, and Language Line Solutions. And our futurist sponsors, Certified Languages International, Children's Health, De La Mora Institute of Interpretation, HCIN, Universe Technical Translations, and the Translation and Interpretation Network. And of course, we've got our exhibitor associations. We've got the American Translators Association, the Houston Interpreter and Translators Association, and the National Council on Interpreting and Healthcare. A huge thanks to our ASL sponsor, Globo, for making sure that our event is accessible today. Our RID CEU sponsor, where are my ASL interpreters? We got a few, there we go. Yes, thank you to Language Line Solutions for being our RID ASL sponsor. And there's a little hospital system in North Carolina that was kind enough to be our lanyard sponsor. You may have heard of them. They have a few hospitals. Atrium Health. Danilo, thank you so much. How many of you attended the quinceañera reception last night? How many of you did not attend? Please stand up. Shame, shame. We literally exceeded the capacity of that building last night. It was an amazing, amazing party. Angel Share is a charity bar. It's the only charity bar here in Houston, Texas. They were our community partner for our reception. Coffee today provided by A Second Cup. They are a nonprofit that works in human trafficking. Breakfast this morning from Tacos A Go-Go, also a local favorite here in Houston. We've got lunch coming from Phoenicia Specialty Foods. And this afternoon, for our break, we will have a Tres Leches cake from El Bolillo Bakery to celebrate our quinceañera. My formatting is a little off there. As I mentioned, I'm incredibly, incredibly proud to be a part of this team.
You know, I'm from Ohio, but what I heard is everything is big in Texas, right? I want to say that if you want to see a man with a heart who's is big and bigger than Texas, that's Jorge Ungo. Thank you, Jorge, for everything you do for us.
I don't think... Thank you so much. I don't think they are in this room right now, but Yami Becker, Sean Morganlander, Eddie Alnati, of course, Natalia Mitareva. I've never seen a group of people work so hard behind the scenes to keep CCHI going. It's incredible. I was a commissioner for 6 years. And as a commissioner, you get to see a lot, but you don't get to see truly what goes on behind the curtain. And it's just, it's astounding. It makes me incredibly, incredibly proud to be a part of the team. Okay. I think I got it out, so. All right. We are also proud to have an incredible group of commissioners. We have our executive committee. I keep looking back here, but I have those up there. We have our executive committee, Madam Chair. Where is Madam Chair? There you are, Madam Chair. Vanessa Costa. Where's Madam Vice Chair? I don't see Madam Vice Chair. Registration. Okay, Madam Vice Chair is at registration. Johanna Parker, Valerie Huang, our treasurer, and Mateo Rutherford, also at registration, I'm guessing. Mateo Rutherford is our secretary. Again, an incredible group. But we also have more commissioners. Danilo, Andrea, Paco, Sean, Yasha, Fabio, Mara, Alegna. It's a who's who in language access on our commission, just like it's a who's who here at this event today. Madam Chair, would you join me up here, please? A couple of other thanks, and then we have an announcement. So to all of our speakers, again, as I said, it is a literal who's who of language access in this room. An incredible, incredible group of speakers. You all are gonna have such a great time today. You're gonna have the pick of the litter in terms of sessions to go to, and we'll talk about that here shortly. So thank you to all of our speakers for being here, for sharing your knowledge with us, and we're just incredibly proud to have you all here. And to all of our certificants. Can I get some raised hands for all of the CHIs in the room, please? We would not be here if it wasn't for you, so thank you. And for all of you that are not certified, shame.
Real pleasure to be here today. Greetings and good morning. I'm Sylvia Villacampa. I serve as the Managing Director of Liberty Language Services. Our sister company, Academy of Interpretation, the interpreter training arm, is honored to be a Trailblazer sponsor for today's summit. I want to thank Jorge Ungo and the CCHI for organizing the summit and creating this opportunity to gather again since the first summit in 2019. When I first saw the opportunity to be a Trailblazer sponsor, I thought, how appropriate. Not only do I consider Liberty and the Academy a trailblazing company, but CCHI is trailblazing. And so many of you here are trailblazers, and I love that, to be at the forefront of a movement. Liberty Language Services and the Academy of Interpretation have been in the business of interpretation and translation and interpreter training since 2011. When our company started, the trailblazing aspect was the following: provide quality interpretation services, primarily healthcare and medical interpreting, with credentialed interpreters. What does that mean? Besides the numerous requirements for working on-site at a medical facility, this also meant all interpreters sent on-site. All interpreters would have, at a minimum, a 40-hour medical interpreter training course, certificate of completion. That was in 2011. It was trailblazing for then, and you won't be surprised to hear that in some places it still is. However, things continue to change for the better. More and more healthcare facilities and the language service providers that they hire make credentialing an enforced requirement. Around the country, credentialing requirements include having certification in healthcare interpreting or medical interpreting, so either CMI or CHI. CCHI continues to be a trailblazing organization, and I have great admiration for all that it has accomplished and the continuous efforts toward credentialing and certification. I believe that everyone in this room and attending the summit is a trailblazer. From CCHI, the invited speakers, and attendees, you are here because you have made a difference and want to make a difference. and ensure that the trailblazing continues. I want to take this opportunity to express some words of gratitude. Our company's efforts could not have been possible without the vision of our founders, Timothy Worster and Samit Abdulkader. In addition to the mentors they consulted with on interpreter credentialing and how to provide the best quality language services, that would include Vanessa Nino of MedStar Health and also Mara Yodelman. We appreciated, and I want to mention too that back in the day, we were a pilot CCHI testing site, and Kathleen Diamond was the founding commissioner that came to our location in Virginia. Anything to assist the effort to certify more interpreters. And last but not least, all the interpreters that have worked with our company and all of you, whether for a short stint or for over 10 years, day in and day out, in order to serve local communities as medical and healthcare interpreters. So what is next as a trailblazer? For many here, the work is endless, and I see CCHI continuously striving. CCHI does not sit on its laurels. They are a model and its leaders an inspiration. For the rest of us, let's continue the work that supports credentialed healthcare interpreting. For example, seek out mentors, new learning and growth, get involved in associations both local and national, attend events, take on leadership roles, become a board member, or serve on committees of an association. See what CCHI has to offer in terms of how to become involved. Be a sponsor to an event. Show up and give back. There is no greater reward than to do your part in this important and impactful trailblazing work. Thank you all for your time and your dedication.
Thank you so much. Okay, I'm gonna try not to cry. So 20 plus years ago, I was looking for a job. I didn't care what I was gonna do. I just wanted to answer the phone. And I answered a want ad for a little place called Masterword Services. I wouldn't be here today if it wasn't for you.
So, George, I also want to acknowledge you. And by the way, yesterday we made a decision that we're going to retire together playing bingo. A great round of applause to everybody in this room who has done an incredible job in language access. Can we acknowledge everybody in this room as a leader? I am so grateful and so humbled to be here today and yesterday. So last year we turned 30 as Masterword, and we became the first vicarious trauma-informed organization. I didn't know that such thing existed. It now does, in accordance with the Office of Victims of Crime. I would be teaching a class this year. We want every organization in our industry to follow in our steps. So we're doing also monthly meditation sessions for anybody who wants to attend. And May 2nd, great free event with the Synergetic Play Therapy Institute online with all of the CEUs called Resilience in the Trenches, Vicarious Trauma Mitigation for professionals on the front line. And we are going to learn a new tool, the role of external regulators in trauma integration. Please, 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 it's not enough. There's going to be not just interpreter CEUs. It's going to have social worker. It's going to have mental health worker. It's going to have every CEUs that we work with. So please join. Next, very important announcement is that, there will be a session on Safe AI. About a year ago, May 15th, a group of incredible individuals came together and said, we want to know how we handle change right now in the age of AI. And we formed a task force, stakeholders advocating for fair and ethical adoption of AI in interpreting. Incredible work. Every single professional organization, not just in the United States, globally, many organizations joined us globally, such as AIC. the first, I believe, in history, collaborative effort with the deaf community and all of the associations of deaf interpreters came together, and out of that came a survey. 82 countries, 48 states participated in the survey. It was done in 9 languages. In addition to that, 11 stakeholder groups where interpreters were just one. An incredible study conducted by the Deaf Advisory Group under the leadership of Tim Reich, who's one of the people here, so please acknowledge, and a lot of other. And out of that came a 350-page document, which we also provided a summary of that document, plus the study for the Deaf Advisory Group Guidelines Committee, under the leadership of Natalia, who did that other 60-hour, and Matteo, yes, Matteo, please, round of applause. And that was a volunteer 60-hour-a-week job since May 16th, part-time for a large group of people. So please stay tuned. All of the information is available online for free. Please use this. Please build up on this and come to the presentation. But if you cannot, go visit the website and stay tuned. And the last announcement is, as you know, we are living today in a very divided world. But I'm not going to go into politics. I'm going to go into language. When we talk about language access and digital access, we all live on Facebook, social media. But a little known fact that about 4 billion people, which is about half the world, don't have that privilege. 3 billion people don't have any digital access, period, because they don't have a computer or access to electricity. 40% of the world don't have access to education and the language they understand, and as a result, feed not just into poverty, but into extreme poverty. And CSA research is going to come up with the numbers, which preliminary numbers, somewhere around 4.8 billion people don't have digital presence. We are not talking about communities of endangered language with 2 speakers. We're talking about Fulani people in Africa, about 70 million speakers, no digital presence online. And at the same time, in that space, we have incredible leaders. You all have watched the movie Frozen. 3,000 speakers of the Sami language, among them 800 speakers of the Lulu Sami. I believe half of them, or the entire adult population, is in localization. They have built their own tools, and they have built everything. However, large tech companies don't let them in. Every time Microsoft pushes out an update, which is very frequent, everything they build breaks. They have to start from scratch. And 5 years ago, they were talking at the launch of the Year of Indigenous Languages about the fact that we want to create open language access. And 5 years later, they're still talking about it. So we moved today from physical colonialism to tech colonialism, where a large tech company decides this language is not commercial for me. This community doesn't have the right to access the same opportunities as the rest of us do. So we started a project last year with Mayan language digitization. Dr. Winston Scott is leading this project, and he is an anthropologist who joined our movement. We picked a community where only 1% of the population graduates past 6th grade because they don't have language access. 70% of the people are illiterate. And by the way, this project is not funded. And we figured, you know what? Yes, we can. So we've organized an incredible community effort. The whole project is open source. Today, there is an online glossary on Wiki that you can access where we're collecting medical terminology, legal terminology, terminology on a whole number of other subject areas. And it's grown into a huge community effort with collaboration with schools in Guatemala. We've just created the first keyboard for Mayan languages, which we have launched, and are working on the Yucatan keyboard. knocking on the doors of groups like Microsoft who just said not interested, don't know how to add that to the typical Microsoft suite. So next week we'll be advocating, and hopefully this too will happen. But I want to bring to the attention of everybody in this group that language advocacy, we want to expand it beyond just language access in the typical setting that we have been working with to digital access and in the world of AI. And thank you again. And I probably went past the 5 minutes, but I just want to talk about it. Thank you, guys.